Hi class, welcome to chapter 10, the water-soluble vitamins. Vitamin means vital to life, and we cannot produce vitamins on our own. Therefore, we have to eat vitamins from or consume vitamins from different food sources. Vitamins are essential for life, and without them, different toxicities can occur. For example, without vitamin D, bone disease can develop. Without vitamin B, different dementias or skin disorders can develop. And without vitamin A, night blindness can develop. We don't get calories from vitamins. They do not contain any energy. However, they still are vital for life. And we generally need just a very small amount of vitamins. Vitamins can be absorbed different amounts in the body based on their bioavailability. And so sometimes we get vitamins in supplement forms, as pictured on the last slide. Sometimes vitamins are bound within foods that we eat. It's possible to get vitamin injections or vitamins through an IV. And so depending on how we get our vitamins, as well as maybe perhaps how the food was prepared, how fresh the food was, our own digestive status, etc., we may be able to absorb and digest and utilize a higher percentage of those vitamins or not. So not all vitamin sources, as well as cooking methods, preparation methods, isolation methods, are considered to be equal. Precursors. So there are pre-vitamins or precursors to vitamins, and those are called provitamins. And a really classic example is beta-carotene, and beta-carotene is found in green leafy vegetables as well as in carrots and orange foods such as sweet potatoes. And beta-carotene is a precursor to vitamin A, so if we're consuming beta-carotene, our body can convert it to its active form, which is vitamin A. Water-soluble vitamins are what we'll be discussing first, and generally speaking, we classify vitamins into water-soluble and fat-soluble. With regards to water, we mean the blood. So our blood is very aqueous or water-like, and the water-soluble vitamins are transported easily in the blood. They're absorbed easily across the cells, etc. They don't generally require any carriers. So maybe you remember we talked about the lipoproteins, and lipoproteins are protein carriers that are required for fat-soluble vitamins. But those are not required for water-soluble vitamins. Because they are water-soluble, we can also get rid of them in the urine. It is possible to develop a toxicity from the water-soluble vitamins, but because we are able to get rid of them in the urine relatively easily, toxicity is more rare from the water-soluble vitamins, and many of them actually don't have any upper limit levels. Because we do get rid of them easily, though, we need to replace them frequently. And some estimates think that this is every 1 to 3 days. Depending on the vitamin type, it may be slightly longer than this. I've seen some that are up to weeks. With vitamin B12, for example, we may not see deficiency signs develop for many years. So it really is variable between the different vitamins. Minimizing nutrient losses refers to minimizing vitamin and mineral losses within the foods, and we can do this by selecting certain foods that are in season, by washing the foods right before we're going to cut them, but not after we cut them. If we cut the fruits and then wash them, we actually have a risk of washing away some of those water-soluble vitamins. We should store our fruits and vegetables away from oxygen, so in plastic containers or glass containers, versus potentially just on the counter open. They'll oxidize easier that way. And certain preparation methods can destroy vitamins. So high heat can destroy certain vitamins, microwaving can destroy certain vitamins, cooking with a lot of water, etc. And each vitamin has individual conditions which will cause it to be retained versus not retained. And so we have to learn these for each and try to follow them if we want to get the most nutrients out of the foods that we're consuming. So our first vitamin is called thiamine, and this is called vitamin B1. And thiamine functions as part of a coenzyme, and a coenzyme is something needed for an enzyme to work. So without a coenzyme, certain enzyme cannot work. And the particular coenzyme that thiamine functions in is called TPP. And this converts the 3-carbon pyruvate to the C-carbon acetyl-CoA. Where can we find thiamine? It comes in fortified grains and rich products, whole grains. That's what's pictured here. Also nuts and seeds and some legumes. And generally speaking, people tend to get enough thiamine because it is added back to grains that have been processed, as well as it occurs naturally in whole grains. In other countries, however, they don't always fortify their food supply with thiamine, and so one example of thiamine deficiency is where people consume a lot of white rice. And white rice is rice with the outer husk removed, all of that whole grain portion of the rice removed, and this can make up about 80 to 90% of the diets in certain countries. We also see thiamine deficiency in alcoholism. And thiamine is important to energy metabolism, so production of ATP, nerve conduction, and muscle activity. Thiamine's role as a coenzyme, so I mentioned that thiamine helps convert the 3-carbon pyruvate to the 2-carbon acetyl-CoA, and so thiamine would actually be found right here as TPP. TPP also plays a role in the tricarboxylic acid cycle and converts a 5-carbon compound to a 4-carbon compound so that the cycle can reverse to the beginning or go back to the beginning. So in that way, it's very important for production of ATP, and if we had a deficiency in thiamine, this part that it plays a role in would halt and we wouldn't be able to convert pyruvate to acetyl-CoA. Luckily, that's not that common in the United States. Deficiency. Deficiency can occur at any age. It is common in infants, especially infants who are 100% breastfed if their moms are not consuming enough thiamine. So thiamine, as it's water soluble, it's transferred through the breast milk, as are all the vitamins and minerals. However, if mom does not have adequate thiamine, she won't be able to transfer enough to baby, and baby can actually die from thiamine deficiency. It's called infantile beriberi. Babies become very weak. They're so weak they literally can't even cry. And then in adults, there's something called wet beriberi and dry beriberi, and you can see some of the symptoms pictured on the right. We don't see adult thiamine deficiency as commonly anymore, but it does still occur in some developing countries. Sources of thiamine in the United States, all foods that have been refined or all grains, thiamine is added back to them. So we do see it occurring in those. It is found in beans, it's found in soy, it's found in certain meats, specifically pork. It's found in acorn squash. And you can see on the top in yellow, we have the grains where it's been added to. Next B vitamin is riboflavin. And riboflavin, again, is another part of a coenzyme. So without riboflavin being present, an enzyme wouldn't be able to work. So it's part of the coenzymes FSN and FAD. And what these two coenzymes do is they donate electrons to the electron transport chain. And so remember, our electron transport chain is a significant source of ATP. So without riboflavin, we wouldn't have as many electrons moving through the electron transport chain. This is just one of the roles of riboflavin. It's important for many other things as well. We don't see deficiency happening that commonly in the United States, but it can cause inflammation of the membranes around the eyes, the tongue, the mouth, the GI tract, and the skin. And there is no upper level for riboflavin, so we don't have to worry about over-consuming it. This is a picture of those two coenzymes, Flavin mononucleotide and Flavin adenine dinucleotide. And you can see that FAD can be converted to FADH2, just like FMN can be converted to FMNH2. And in that way, these two coenzymes can accept and donate hydrogens and their electrons through the electron transport chain. Sources of riboflavin. So if you like liver, you are in luck. Liver is really high in riboflavin. It's also high in many other vitamins and minerals, which we'll see throughout this course. But if you're not a fan of liver, you can find it in eggs, you can find it in clams, mushrooms. Dairy products are one of the biggest sources of riboflavin in the US diet, and it's in some fortified grains as well. So if people are vegans or vegetarians and they're not consuming meat or dairy, they should be certain to consume some fortified food sources as well as a variety of fruits and vegetables and maybe some mushrooms too. Whole grains are a good source. Dark leafy greens are also a really good source of riboflavin. So why is milk in the opaque or cardboard containers? This is a trivia question. The reason that milk is in these containers is that milk is fortified with riboflavin and has riboflavin content, but riboflavin is destroyed by light. And if milk was in a clear container and exposed to light, the riboflavin content in it would drop significantly, and we wouldn't be able to get any riboflavin from the milk or dairy we were consuming. Niacin, B3, again, part of a coenzyme. So it's part of a coenzyme NAD, which is nicotinic acid and nicotine amide, etc. So it is used in energy metabolism, and it's important for conversion of different amino acids. We can make niacin from tryptophan, but that means that we have to have enough tryptophan in our body, and it takes 60 milligrams of tryptophan to make 1 milligram of niacin. So it's not a very efficient conversion. Deficiency of niacin is called pellagra, and we'll see some pictures of pellagra coming up. We don't see pellagra that commonly anymore, but in the 1900s, it caused close to 100,000 deaths where people were on very kind of nutrient poor diets. They were surviving on corn alone, and there's not a lot of niacin in corn. It also doesn't have a lot of tryptophan, so you can't convert the tryptophan to niacin. Another interesting thing, leucine interferes with the conversion of tryptophan to niacin, and corn is high in leucine. So these high corn diets did promote niacin deficiency. Niacin toxicity is possible, but we don't usually see it being caused by food sources. We do sometimes see it being caused by supplement sources. And one of the things that can happen with let's go here first. Niacin toxicity is Niacin Flush, and this can occur when a niacin supplement or nicotinic acid is taken in doses that are 3 to 4 times the RDA. And why would you do this? Well, one of the functions of niacin or effects of niacin is it can help with blood pressure control. And so some people will take it for blood pressure. People will also take it for cholesterol. Its role in cholesterol is much stronger than its role in blood pressure. So sometimes doctors will prescribe it as an adjunct to cholesterol lowering meds. And by lowering the cholesterol, if it's causing plaque buildup, sometimes you can have lower blood pressure as well. Going back to deficiency, I said that deficiency is called pellagra, and pellagra has the symptoms which are called the 4 Ds, and these are diarrhea, dermatitis, which is a skin inflammation, death, and dementia. Death only occurs in very severe niacin deficiency, but has occurred before. You can see here pictures of different dermatitis caused by niacin deficiency, and you may notice that many people have this dermatitis on their face, their hands, or their neck. Sometimes we call this like a niacin necklace or niacin pellagra necklace, where people get this kind of dermatitis around their neck, and it's indicative of a possible niacin deficiency. So we saw niacin flush. And then here are these coenzymes, so nicotine amic adenine dinucleotide and nicotine amide adenine dinucleotide phosphate. And NAD can bind to hydrogens as well as NADP, and so they can bring those to the electron transport chain. Sources of niacin, again, we find it in fortified grains. It does naturally occur in beans and seeds, as well as some dairy. It's very high in meat, so chicken, tuna, ground beef, liver, pretty high in peanuts and mushrooms, super nutrient rich. And we also see it in potatoes. So these are some sources. In the US diet, we get a lot from fortified cereals. Biotin. So biotin is surprisingly a part of another coenzyme. So you're getting kind of the message with these B vitamins is they all act as coenzymes in metabolism. This is important for metabolism of all the macronutrients, and it's critical to the TCA cycle, which is going to help generate energy. Generally speaking, we don't see a lot of biotin deficiency in the United States. There are multiple sources of biotin, and it also can be produced in our large intestine by some of the bacteria that colonize there. If people are eating raw egg whites, there's a protein in raw egg whites called streptavidin, and it can bind to biotin and make it unabsorbable. So those people would be at risk for deficiency. There is no upper level for biotin, so you don't have to be worried about consuming excess biotin. And I've seen it a lot in supplements for hair or nails or skin in really, 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 really high levels, which is okay because there's no toxicity concerns. Pantothenic acid, so another part of a coenzyme, and this is part of the coenzyme A, which is part of acetyl-CoA, so a very, very vital coenzyme with regards to energy metabolism. Similar sources to some of the other B vitamins, whole grains, meats, organ meats like liver, mushroom, etc. And deficiency of pantothenic acid is very, very rare, but it may cause vomiting, diarrhea, cramps, insomnia, etc. We did see some deficiencies developing in World War II where there were severe nutrient limitations, ration limitations, and some of the soldiers in World War II had burning feet as a syndrome of pantothenic acid deficiency. There's no upper limit for pantothenic acid, so you don't have to be worried about overconsumption. Pyridoxine, pyridoxal, and pyridoxamine are actually three forms of what we consider to be vitamin B6. And all three of them can be converted to the coenzymes PLP, or the coenzyme PLP. They also play a role in the coenzyme PMP. And coenzymes, again, are important for energy metabolism. PLP can transfer amino groups from an amino acid to a keto acid, and so it can help the body make some of the non-essential amino acids. Also, conversion of the amino acid tryptophan to niacin, or we just talked about that, or to the neurotransmitter serotonin, which is really important for mood, plays a role in depression, anxiety, etc. All rely on PLP, and PLP is important for heme synthesis, DNA synthesis, lecithin synthesis. So very, very important vitamin. It can be destroyed by alcohol, and so we do see deficiencies in alcoholics quite a lot. Alcohol can dislodge PLP from its enzymes, and then it can be broken down and excreted so that it can't play a role in metabolism. Without B6, we have diminished synthesis of those neurotransmitters, and this can cause abnormal tryptophan metabolism, as well as can cause abnormal brain waves, can contribute to cancer, cardiovascular disease. There are many drugs that interfere with B6. You don't have to know them for this class, but there is a tuberculosis drug that can bind and inactivate B6. Also, there's a drug for Parkinson's disease called levodopa, which can interact with B6. This is a picture of the coenzyme PLP, and this PLP can be used to transfer the amino groups to make the non-essential amino acids. It's also vital to the conversion of tryptophan to niacin. Remember, we needed 60 milligrams of tryptophan to make one niacin, or tryptophan to serotonin, and it's important for DNA, RNA, and lecithin synthesis. So this is important for cell division, development of new cells, etc. Sources of B6. Banana is great, cornflakes, or any other fortified cereal. Watermelon is pretty high. Some of the greens are pretty high. Potato, not as high in dairy, not as high in seeds or nuts. Decently high in some of the meat products, very high in prune juice, bluefish, and acorn squash. So those are some of the food sources of B6. And we don't see B6 deficiency that commonly as far as people not consuming enough, which would be called a primary deficiency, but we do see secondary B6 deficiencies, meaning its absorption is hindered, maybe due to alcoholism or medications or other issues. Folate, so another part of an enzyme. It is part of the coenzymes tetrahydrofolate and dihydrofolate, which we'll see coming up. It's important for DNA synthesis. One of the important functions it has is forming the neural tube in embryonic development. And the neural tube is the precursor for the brain, the central nervous system, the spinal cord. And this develops in embryos about 21 to 27 days into fetal development. So a lot of times women don't even know they're pregnant when this is happening. And so that's why folate is often in pretty high amounts in prenatal vitamins, and women of childbearing age are encouraged, and the RDA is actually higher for them, for pregnant women, to take more folate to reduce the risk of having a neural tube defect in their child. It also plays the role in heart development, and can play a role in cancer as well as development of the oral palate. I'll go back here. So this is a case of folate deficiency, and this baby has what's called spina bifida, and so a portion of his spinal cord is protruding outside of his skin, meaning it hasn't completely formed or been protected. These babies, these are pictures that I took in Mexico, and all these babies had severe cleft lip, cleft palate malformation. There are many reasons for this, but folate is a common one, and I went down there with Doctors Without Borders to help translate the best I could, which was not that great, but to help assist the nurses and physicians who performed these surgeries to fix these abnormalities. Sources of folate. So leafy greens, I like to think of folate as the foliage. And although it is found in many foods, it's not as bioavailable in foods because it can be bound up by other nutrients and occurs in a different form of foods than in supplements. So the supplement or synthetic forms of folates can be much more bioavailable than the food-bound sources of folate. And so for pregnant women, they generally recommend that pregnant women get a part of their folate from a supplement and the rest from diet. Folate has a big role with B12 activation, as well as B12 has a big role with folate activation. And if you are consuming too much folate, it could possibly mask a B12 deficiency, which wouldn't be good because you would be at risk for long-term B12 deficiency complications, which include neurological complications. THF, or tetrahydrofolate. So tetrahydrofolate, THF, is an coenzyme that plays a vital role in so many things, but you see it right here, and it is helping convert B12 to its active form to form DNA, RNA, etc. Dihydrofolate reductase is DHF, and that is found right here. So that would be the other enzyme I talked about. And then there is also one called metrotetrahydrofolate reductase. So folate plays a role in many different enzymes, and you can see some of the end products of this are DNA synthesis. So without folate in appropriate forms and appropriate sources, we would not be able to activate B12 or synthesize DNA. Folate's absorption and activation. So folate includes a ring structure and a glutamate, and in natural foods, it occurs as a polyglutamate. In fortified foods, it occurs as a monoglutamate, meaning in fortified foods, there is only one of these blue squares or glutamate compounds attached to the ring structure in folate. And because of that, it's much easier to break down. Folate can be absorbed through the intestinal cells, and in order to activate folate, B12 will come in and remove a methyl group, and then that's a CH3 that will activate B12. The CH3 will bind to B12, and then the folate will be without the methyl group, and folate will be activated and can play a role in DNA synthesis. Folate and B12 are both involved in blood cell formation because of their role in DNA synthesis. And so in folate or B12 deficiency, what happens is RNA synthesis is unmonitored, and it will continue and form a large nucleus in the cells. But our red blood cells are actually not supposed to have a nucleus. They're supposed to be without a nucleus. And so what happens in folate or B12 deficiency, because of the relationship to DNA synthesis, we have these large, kind of irregularly shaped cells that are not very effective at carrying oxygen. And this is sometimes called a macrocytic, meaning large, or megaloblastic anemia. And they're actually considered immature red blood cells. Sources of folate. So folate is generally fortified into our grain products. It also will occur naturally in whole grains. Other good sources: lentils, asparagus, pinto beans, tomato juice, orange juice, tofu, some seeds, etc. So those are all good sources of folate. B12. So B12 also plays a role in coenzymes, and B12 is necessary for folate activation, and folate is necessary for B12 activation. B12 is important to make new cells, for DNA synthesis, for the nerve cells in our brain. It helps break down fatty acids, and sources of B12 are animal products. It's possible to grow yeast on a media that's been enriched with B12, which will cause yeast to take up B12. And so many vegans or vegetarians will use nutritional yeast as a B12 source, and they can sprinkle it onto their foods. It has kind of a savory umami flavor. If they don't use nutritional yeast, they can just take a B12 supplement, but B12 is one of the main deficiencies that vegetarians or vegans are at risk for, so it's important that they supplement their diet in one way or another. Folate acid and B12. So here you see the THF and the 5-methyl-THF enzyme, and this can convert B12 cobalamin to B12 methylcobalamin, and then methylcobalamin to cobalamin. And B12 is important for homocysteine metabolism, and so B12 can convert homocysteine to methionine. Intrinsic factor. So intrinsic factor has to do with the absorption of B12. And what happens when we consume foods that have B12 in them is B12 is protein bound. So we have B12 and it is generally bound to a protein because it usually comes from our animals' foods or it comes from our nutritional yeast. So once this B12 and protein complex hits the stomach, which looks like this, it relies on something called hydrochloric acid, HCl, to separate the B12 from the protein. So that will separate the B12 so that it's now in the stomach. The B12 can go through the intestinal tract, which looks kind of like this. And so now we have B12 in the intestinal tract. B12 needs to bind to something called intrinsic factor. And B12 and intrinsic factor will form a complex. They will travel to the end of the small intestine called the ileum. And then B12 and the intrinsic factor complex will be recognized by cells in the ileum, and B12 will be absorbed and intrinsic factor will be recycled. And so as far as B12 deficiency goes, if anybody is deficient in either hydrochloric acid or intrinsic factor, they have difficulty absorbing B12. If they are unable to absorb B12, a deficiency can develop. And B12 was important for DNA synthesis. It's also important for red blood cell formation, as we just saw. And so something called pernicious anemia can develop. And pernicious anemia happens when people do not have that intrinsic factor. And so their B12 will travel through the small intestines and not be absorbed. And lack of intrinsic factor can be a genetic condition. Also, our intrinsic factor decreases with age. And so elderly people commonly have actually reductions in both hydrochloric acid, stomach acid, and intrinsic factor, which can make elderly people especially susceptible to pernicious anemia or B12 deficiency that's leading to large red blood cells that are immature. How do we treat this? We can give B12 injections. B12 injections do not require hydrochloric acid or intrinsic factor to be absorbed because they're given directly into the blood. And there are also some nasal sprays that are being developed. Some supplement forms of B12 are considered crystalline, and those also may not require hydrochloric acid in such high amounts or intrinsic factor to be absorbed through the blood. But the solution for B12 is not to simply just eat more foods, because if somebody lacks intrinsic factor, no matter how many foods they eat, they still won't be able to absorb that B12. This picture is looking at metabolism, and you see the TCA cycle here, you see glycolysis, you see the electron transport chain, and these small purple boxes are all coenzymes, and each of those coenzymes represents a different vitamin, one of the water-soluble vitamins, and in some cases we have vitamins itself, such as biotin. So you can see that if you have a deficiency in these water-soluble vitamins, your entire metabolic process is going to be interrupted and everything is going to slow down. Vitamin C. So all of the B vitamins are considered water-soluble, and then vitamin C is also considered water-soluble. And you can think of vitamin C for collagen. And so collagen helps make up some of our skin and some of our different structures within the body. Vitamin C works as an antioxidant, so it can scavenge free radicals. It can neutralize free radicals, and free radicals have unpaired electrons and can cause cellular damage. Vitamin C, I'm sure you guys have heard of airborne or emergency, but vitamin C is involved in the immune system, and taking vitamin C can reduce some of the symptoms of a common cold. Doesn't necessarily cure the cold, but it can reduce the sniffliness, the runny nose, etc. And it does that by deactivating histamine. So it kind of works like a weak antihistamine. It may also reduce cold time about 8%. So if you have a cold for 10 days, maybe this is just a little less than a day less if you're taking a vitamin C supplement. Everybody thinks of oranges as being rich in vitamin C, and they are, but there are many other foods that are rich in vitamin C that should be included as well. And vitamin C helps with iron absorption. So if you're eating iron-rich foods or cooking in a cast iron skillet, and then you simultaneously consume vitamin C-rich foods, you're going to ensure that more of that iron is absorbed. Vitamin C toxicity is possible. We don't normally see it coming from food sources, but it can happen due to supplement sources. And there is an upper limit set for vitamin C. Common side effects include diarrhea, gastrointestinal discomfort, possibly contribution to kidney stone formation if somebody already has kidney disease, etc. We do see vitamin C deficiency. A prehistoric kind of deficiency disease was called scurvy, and scurvy led to pretty much breakdown of collagen, breakdown of skin, breakdown of gums, loss of teeth, sunken eyes, reduced immune system, and actually could cause death. Could cause reduced muscle function as well, and some neurological implications. And in the early 1700s, when people set sail on the seas, 1 out of every 2 people would die from scurvy. And for the longest time, we didn't really understand why people were dying. We didn't know what it was called, but we just saw these symptoms, sailors becoming very weak, etc. And they did some experiments because they thought maybe it was related to food shortages, as you take limited food on sea. And so they had a ship full of men, and they put them into different groups. They gave some cider vinegar. They gave one group sulfuric acid. Can't imagine being in that group. One group seawater. Feel bad for that group as well. One group oranges and lemons, or a strong laxative. So those were some of the early interventions done. But what they found is the group who got the oranges and lemons did not develop scurvy and did significantly better. And oranges and lemons are rich in vitamin C, but limes are also rich in vitamin C, and limes tend to keep longer than oranges or lemons. So they would start sending limes, oranges, lemons, etc. on the ships after that. And they called whatever factor was in the citrus fruit the anti-scorbic factor, or ascorbic acid. And so some of the sailors were nicknamed limeys. These were the British sailors, and they didn't see as high of rates of scurvy anymore. This was in the 1700s, so you wonder, is this still applicable today? And yes, we do still see scurvy today. We don't see it as much on ships, although it is possible. But sometimes we see this in very, very picky eaters. For example, there have been multiple cases of scurvy developing in children with eating restrictions, or severely autistic children who would only eat a few things and limit fruit and vegetable intake. So this can still happen today. Since vitamin C plays a role as an antioxidant, people who smoke and are at high risk for oxidative stress should include more vitamin C daily. Sources, you saw some pictured there. I discussed them above. Broccoli, red bell pepper, kiwi, Brussels sprouts, orange juice is on there, but all these things are high as well. We don't usually find it in meats or dairy. It's primarily in our fruits and veggies and not in our breads. Vitamin C is vulnerable to heat, so consuming raw fruits and veggies can be a good way to get vitamin C. It's also susceptible to oxidation, so if you can eat fruits and vegetables closest to the time they were picked, keep them, away from oxygen by putting them in Ziploc bags or glass containers, not cutting them ahead of time, etc. That can help with the vitamin C content. Vitamin C is pretty high in potatoes, and so when there was an Irish potato famine, we actually saw vitamin C deficiency and scurvy develop throughout Ireland because this was such a staple of their diets. So in summary, these are the water-soluble vitamins shown up top that we discussed. We discussed all of the B vitamins and vitamin C, and further chapters will look at some of the fat-soluble vitamins, which are A, D, E, and K. Our highlight for this chapter is about vitamins and mineral supplements, so very fitting. And you could spend an entire quarter or an entire semester talking about this topic. So this is very, very brief, but I encourage you to read more about it on your own, do some research on your own, because taking vitamin and mineral supplements is so common. I take some myself. I'm sure many of you do as well. And we have to be aware of possible benefits, but also possible risks and kind of what we're potentially getting ourselves into with these. So reasons to take supplements. These are arguments to take supplements. They can help correct deficiencies. So an example is vitamin K1 right here. And when infants are born, they don't have adequate K1. And K1 plays a really important role in blood clotting. And so infants are given K1 to correct a deficiency and to allow their blood to clot so that they're not at risk for bleeding or hemorrhaging. With calcium, vitamin D, B12, there are so many deficiencies that we can correct with taking a supplement. Vitamin A plays a huge role internationally. Iron plays a huge role both nationally and internationally. Increased nutrient needs. So during pregnancy, child growth, potentially menopause, with being an elderly person, there's certain vitamins and nutrients that you may need in higher amounts. Improve your nutrition status. So maybe your diet isn't as good as you'd like it to be, and you're finding that this kind of works as a supplement to you. Improve your immune system. So certain vitamins are important cofactors in the immune system, as well as antioxidants, and potentially reducing disease risk. When they look at meta-analysis, they don't find that people who take vitamins live any longer than people who don't. However, I think there are certain diseases where this could play a role. One of the big developing ones is heart disease and the role of B12, B6, etc., homocysteine, folate. So we're learning more and more about that every day, but the evidence is not 100% clear with that one. Who might benefit from a supplement? There are many people who will benefit from a supplement, and some people think they benefit from a supplement, even though they may not fit into these categories. But anybody with a nutrient deficiency, anybody who has a very restricted diet, maybe whether that's intentional or unintentional, vegans, vegetarians, people who have severe food allergies may benefit from supplements. People with digestive issues may benefit from certain supplements. Maybe people with lactose intolerance who don't consume other calcium sources or vitamin D sources. Infants benefit from iron, vitamin D, fluoride. Elderly benefit from vitamin D, B12. People with different infections or injuries, people who have had gastric bypass often benefit from supplements. And certain medications interact with our body's ability to absorb nutrients. So people taking certain medications may benefit from supplements, as well as people who, maybe have diseases that interact with absorption of certain vitamins or nutrients. When are we concerned? So we're always concerned with toxicity, and generally speaking, toxicity is much more common from supplements than from food sources because our body is really good at regulating natural food sources, vitamins and minerals, and it generally will just absorb less of them if we don't need as much. Also, there can be a lot of misinformation out there. So, vitamins and minerals and dietary supplements in general are not regulated by the FDA. They're governed under something called the Dietary Health Education Act, and this puts about 100% of the responsibility for proving safety, effectiveness, etc., on the company who makes the supplements. And only in the case of a supplement having an adverse outcome does the government step in, and it's still up to the government to prove that the company did something wrong. There are certain risks for certain populations. So iron, for example, can be very pro-oxidizing if taken without need for it. Vitamin A is risky for postmenopausal women. It can lead to hip fractures. Beta carotene, if you're a smoker and you take beta carotene supplement, it can actually increase your risk of cancer. Surgery patients shouldn't take vitamin E or fish oil or perhaps different vitamin K type ingredients because they can influence bleeding and blood clotting. And so a lot of times people will think that if they take supplements, it's going to cure a disease. That is not necessarily the case, and people need to just be very educated consumers and cautious with regards to what they're taking and not taking. Caution and common sense. So if you are going to take a supplement, I tend to look for supplements that have about 100% of the daily value or less. You'll be very low risk if you take a supplement that is 100% of the daily value for less. You always want to make sure that a supplement does not exceed the upper level. And you would think, like, how can it even be legal to sell a supplement that's over the upper level? It's 100% legal, surprisingly. But vitamin D, for example, I bought a supplement over the counter that had 5,000 units vitamin D, and the upper level is 4,000. So you always want to look for that type of information. You can find upper levels online, National Institutes of Health, or inside your textbook. I mentioned that supplements are regulated under the Dietary Supplement Health and Education Act. However, really, they're not regulated at all. So they do regulate having a label, and certain things have to be on the label. They do regulate what claims can and can't be made on that label, but they do not have to prove that they're safe or effective. They don't need FDA approval before being put on the shelves. There's no standards for concentrations of supplements, meaning how potent it is. And there's no requirements for warnings of side effects. Also, the company is supposed to, put what they say they have inside the supplement in a form that your body can digest and absorb it, but there's no regulation of that. So if you're taking a vitamin C supplement that says it's giving you 100% of the daily value, you don't know that that's true. It might only give you 10% of the daily value, or it might give you 200% of the daily value. The supplement company is supposed to be honest, but nobody's double checking them. There are a few companies that do double check supplements, but they're done on a voluntary basis, or the supplement company has to pay for it themselves. And some companies that do check supplements for their potency, their purity, their ability to be used by the body, their manufacture in a clean facility, are USP, US Pharmacopoeia, NSF, National Sanitation Federation, or Consumer Lab. So if you are buying a supplement, you can look for one of these decals on it. And obviously the decals don't look like my writing, but some of these indications on the product, and that means that that product has been evaluated by a third-party company for its safety, its effectiveness, and its integrity. So I try to buy supplements that are from companies such as those. So, quiz. Are vitamins what? They are either soluble in water or fat. The rate at and the extent to which a vitamin is absorbed and used in the body is known as bioavailability. Many of the B vitamins serve as, this should be an easy one, coenzymes. With respect to thiamine, which of the following is the most nutrient dense? So remember, nutrient dense has to do with how much of that nutrient per calories. So 1 slice whole wheat bread, 1 cup yogurt, 1 cup snow peas, or 1 chicken breast. Right away, I'm going to get rid of the chicken breast because it has the least thiamine for the highest calories. Next, I'm going to get rid of the yogurt. It also has high calories and less thiamine than some of the other foods. And so I'm down to the whole wheat bread, which has 69 calories and 0.1 milligram thiamine, or the snow peas, which have 69 calories and 0.2 milligrams thiamine. And so the answer here would be C. The body can make niacin from tryptophan. The vitamin that protects against neural tube defects is folate. A lack of intrinsic factor may lead to pernicious anemia. Which of the following is a B vitamin? Hopefully you said D, pantothenic acid. Vitamin C serves as a C, antioxidant. The requirement for vitamin C is highest for smokers. Okay, class, thanks for listening today, and I'll talk to you next time.